Hello everybody, welcome back to my channel. So hope you all are doing well, enjoying the weekend. And for those who are having exam tomorrow, wish you a very good luck. And I'm 100% sure you can do it. Okay, be confident, you will be fine. All right, so I just came back from work, a bit tired, but someone messaged me in the comment section that they have some doubt in the must scoring system, malnutritional universal screening tool. And I thought, okay, let me just make a video because maybe the person is having exam tomorrow. So in the assessment section, you may get must, which will be pre-filled for you. I will show you a bit. I will show the picture in a bit. Okay, and if you have any doubts in the must screening tool, please don't forget to watch the video till the end. I will make sure that I clear all of your doubts, and stay tuned. Okay, I hope the picture is clear to you. So this is the paper you will get in the exam if you have to do must tool in the exam. This will be the paper. Okay, so it will be circled like this, the one you can see in the picture. So the step one is patient name, date of birth, medical record. It will be all pre-filled. Height and weight, it will be pre-filled. The first step is BMI score. So the first section, the green one, it's written over 20 or over 30, it means obese, so zero score. It's a zero score in the green section. Okay, and the orange one, 18.5 to 20, it says 1. Less than 18.5 BMI score, it says 2. Okay, so it will be circled the way you can see in the picture. It will be circled for you. Moving on, the second step is weight loss score, unplanned weight loss in last 3 to 6 months. So same here, less than 5% is green, 0 score for that, and between 5 to 10%, 1 score for that. More than 10%, orange one is 2, dark orange. Yeah, and then the step 3 is acute disease effect, if the patient is acutely ill and if they have long-term condition, so that is 2. So it will be pre-filled like you can see in the video. You just need to calculate in the last one, total must score. You need to calculate it, how much you get. Then at the end you have low score means 0, medium score means medium score equal to 1, high score is 2 or more than 2. That's the dark orange one. All right, and at the end you have date, you have time, and your signature. So if the person who asked me, maybe he has a doubt, this is the way you will get it in the exam. So just to familiarize yourself with this, I hope it will help. And then I will move on to the next picture and I will talk about that. I hope you're okay now. So this is the second picture. Maybe it's clear on this for you. If in the video it's small, maybe it's okay to read this one. Yeah, this is just to get yourself familiarized with this. After filling it up, you will be provided with this paper which gives you information what you need to talk about. There is step 1, step 2, step 3, but there is nothing for you to read at that time. In the exam section you will not be having that much time. You will have only 12 minutes, so be very careful. Okay, and then it's mentioned here, step 1 is the BMI, which we have already got. Step 2 is a weight loss score, that was the second question. Step 3 is acute disease effect, which was the third step. I've already discussed about that. And then step 4 is the overall risk of malnutrition, and the step 5 is management guidelines, what you are going to do about it. That's the management guidelines. So this paper, it will give you the guideline how you are going to manage, how you are going to calculate the BMI, how you are going to give the patient a score of their malnutritional status. So this is the guideline for you, but you are very lucky that you will get it, so you don't need to remember everything. Okay, this paper will be there in the exam, so you don't need to remember everything. All right, so as you can see here, in our case, the picture which you saw first, our BMI score was 2. So here you can see step 2. Step 2 is number 2 is 2 or more high risk, means the patient is at high risk of malnutrition. This is on the, you can see here, 2 or more high risk treat. Yeah, so how you're gonna treat it, you can read it here. Refer to the dietitian, nutritional support team, or implement local policy. Set goals, improve and increase overall nutritional intake. Monitor, review care plan. If they are in the hospital, weekly. If they are in the care homes, monthly. And if it's they are in the community section, monthly as well. And then, unless detrimental or no benefit is expected from the nutritional support, for example imminent death, so if the patient is on end of life, so you don't want to waste the resources, right? So you need to be very careful. And this is the way you are going to manage if you have a score of 2. I hope it makes sense. And moving on, we will see the picture now for medium risk. Suppose if you get your total score of 1, then how are you gonna manage it? I will show you in the next picture. The medium risk, you are going to document dietary intake for 3 days. If the patient is getting medium risk, you are going to document the dietary intake for 3 days. And if the dietary intake is adequate, you won't be concerned, little concern only. And you can repeat the screening. If they are in the hospital setting, then weekly. If they are in the care homes, then at least monthly. And if they are in the community, at least every 2 to 3 months. If their dietary intake is not enough and you are concerned, then you need to follow the local policies where you can get help from. And you can set goals to improve and increase overall nutritional intake, and then you can monitor their care plan regularly. So this is the way you are going to do it if your patient is at 1 medium risk of malnutrition. Okay, and we will move on to the next one, which is 0 score, low risk. In the low risk, if patient got a score of 0, which means you don't need to worry about, but you can repeat the screening if they're in the hospital every week, if they're in the care homes monthly, if they're in the community setting annually. And for example, for annually, for special groups, for example patients who are more than 75 years old, you can do the screening annually. Yeah, I hope this video was helpful. If you have any more questions about this, about must, please don't hesitate to contact me, message me in the comments, and then I hope I will try my best to answer your all queries. I hope this video was useful. Wish you very good luck for your exam tomorrow, and you can do it. Be confident, and you know everything, so don't worry about that. Be honest. If you forget anything, if you made a mistake, tell the examiner that you forget something, you made this mistake, you can correct yourself. We are still human beings, right? We are human beings, we can make mistakes, so there is nothing to worry. If you still remember it in the exam, go for it. Tell the examiner that you made this mistake. In the real setting, clinical setting, I will not do it. I will make arrangement to correct that one. Yeah, and you will have more chances to get a pass if you are honest to yourself and honest to your patients. Okay guys, I hope you enjoy the video. See you next time in the next video. Take care. Bye bye.